Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your exams. So, okay, today we'll start with the 5 important MCQ for the exam of AIIMS and JIPMER exams. We'll start with a small quote. To be like sun, you need to burn like sun. Okay. சூரியனை போல ஒளிர வேண்டுமென்றால் அதற்கான உழைப்பு இருந்தால் மட்டுமே உங்களால் ஒளிர முடியும். புரிஞ்சுங்களா? So to be like sun, you need to be burned like sun. We'll start today's question. And many people are requested regarding 10 questions per day. So we have decided to change to 10 questions per day, but for that we need your support. So எப்போ வந்து 20K சப்ஸ்கிரைபர் ஆகுறாங்களோ அப்போ தான் நாங்கள் வந்து அதை வந்து 10 கொஷின்ஸாக மாத்திரக்கா பிளான் பண்ணிருக்கோம். ஸோ உங்கள் ஃப்ரெண்ட்ஸுக்கு ஷேர் பண்ணுங்கள், அவங்களும் சப்ஸ்கிரைப் பண்ண சொல்லுங்கள். 20K சப்ஸ்கிரைபர் வரும்போது நாங்கள் 10 questions per day. We are going to change to 10 questions per day. Okay, we'll start today's session. So today we are going to see about renal system. Okay, main questions of urinary system. First question: an older patient with a weakened urinary sphincter is at risk of which condition? An older patient with a weakened urinary sphincter is at which risk of which condition? ஓல்டு பேஷண்ட் இருக்காங்க, அவங்களுக்கு வந்து யூரினரி ஸ்பிங்டர் வந்து வீக்காக இருக்குது. ஸோ அவங்களுக்கு எந்த ரிஸ்க் வரும்னு சொல்லி கொஷின் கேட்டிருக்காங்க. கிட்னி ஃபெயிலியர், பிளாடர் டிஸ்டென்ஷன், யூரினரி ரிட்டென்ஷன், ஸ்கின் இரிட்டேஷன். ஸோ ரைட் ஆப்ஷன் இஸ் ஸ்கின் இரிட்டேஷன். ஸோ மோஸ்ட் ஆஃப் யூ திங்க் தட் இட் இஸ் யூரினரி ரிட்டென்ஷன் ஆர் பிளாடர் டிஸ்டென்ஷன். நோ, that's the wrong answer. The correct answer is skin irritation. So whenever the old patient is having a weakened urinary sphincter, there is a chance for urinary incontinence. So urine to come into contact with the skin. Dribbling இருந்துச்சுன்னா அடிக்கடி வந்து ஸ்கின்ல வந்து கான்டாக்ட் ஆகும். So prolonged exposure to the urine can irritate the skin. So that's why skin irritation is a most common risk for when the old patient who is having weakened urinary sphincter. Not kidney failure, not bladder distension, not urinary retention. Okay, the right option is skin irritation. Next question. Which of the following is a primary glomerular disease? So to answer this type of question, you should know what is primary and secondary. I will explain you. Before that, we'll see the options. Diabetic glomerulopathy, systemic lupus erythematosus, hemolytic uremic syndrome, chronic glomerular nephritis. The correct option is chronic glomerular nephritis. What is primary glomerular disease? Secondary glomerular disease. The disease which occurs within the kidney. Okay, that is called a primary glomerular disease within the kidney. The secondary means some other causes which leads to the glomerular disease. That is called a secondary glomerular disease. Kidney-nala kidney-kulle nadakra problem na primary. Where the disease-nala autoimmune disorders, some other infections in the body that can lead to the glomerular disease means that is secondary. Clear? So here we will see the chronic glomerular nephritis, a primary glomerular disease, because it is characterized by inflammation of the damage to the glomeruli, which are the tiny blood vessels within the kidneys. Remaining one second. Okay, so as I said, here the chronic glomerular nephritis, the disease because it is inflammation inside the glomeruli that is causing the glomerular disease. That is why chronic glomerular nephritis comes under primary glomerular disease. Remaining diabetic glomerulopathy is complication of the diabetes. Systemic lupus erythematosus, option B is showing it is an autoimmune disorder. Next, hemolytic uremic syndrome, that is also secondary glomerular disease. So option A, B, C all comes under secondary glomerular disease except D. So here the question is primary glomerular disease. So the answer is chronic glomerular nephritis. Yes. Next question. Which of these compensatory measures by the body is the earliest sign of the body correcting an acid-base imbalance? The question is, நம்ம பாடியில் வந்து எந்த கரெக்டான ஏர்லியஸ்ட் சைன் நடக்கும் ஆசிட் பேஸ் இம்பேலன்ஸ் இருக்கும்போது? ஸோ த ஏர்லியஸ்ட், த கீ பாயிண்ட் ஹியர் கேட் ஏர்லியஸ்ட் சைன், தட் இஸ் அ கீவேர்ட் ஹியர். ஆப்ஷன்ஸ் ஆர் chain stroke breathing or respiration, low urine output, hyperventilating, sodium retention. So the right option is hyperventilating. Hyperventilation is the earliest sign of body correcting an acid-base imbalance, especially when the carbon dioxide in the level is very high. Okay, clear? So especially in the respiratory acidosis, our carbon dioxide level will be very high. So the hyperventilation helps to eliminate the carbon dioxide, so thereby to maintain the acid-base imbalance. So that's why hyperventilation is a primary sign, not symptom. Okay. So chain stroke respiration, low urine output, sodium retention not related to the acid-base balance when compared to the hyperventilating. So hyperventilation is the first sign to maintain the acidity, reduce the acidity, thereby it maintaining the acid-base imbalance. Clear? Yes. Next, how much urine per hour is acceptable in a post-operative heart patient? So here the keyword is heart patient. So the correct options are given 20 ml, 30 ml, 5 ml, 10 ml. The correct option is 30 ml. So don't think that it is a heart patient or a renal patient, whoever it is. For the normal patient who underwent a major surgery, after the major surgery, the required amount of urine output is 30 ml per hour is an normal urine output. So thereby we can assume that the kidney function also proper, so that body is getting a proper adequate supply hydration status. Clear? So don't think that it's a heart patient or a renal patient. 30 ml per is an acceptable amount of urine per hour. Okay, clear? Yes. Next, question number 5. A nurse is caring for a client who has just returned to the nursing unit after an IVP, that is intravenous pyelogram. The nurse determines that which of the following is important in the post-procedure care of this client. Very easy question. Options: encouraging increased intake of oral fluids, ambulating the client in the hallway, encourage the client to try to avoid frequently, maintaining the client on bed rest. The correct option is option A, encourage the increased intake of oral fluids. Why? Because in intravenous pyelogram, we have given the dye. That dye has to be eliminated. So that we have to encourage the patient to take a adequate amount of oral intake, so that dye will be eliminated through the urine. Simple. Clear? Amplifying the client in the hallway, encouraging the client to try to avoid frequently, maintaining the client on bed rest, not related to, not that much appropriate to this scenario. Clear? I hope today's class was helpful. Thank you so much. We'll meet you in the next session. Please kindly forward to your friends, tell them to subscribe our channel. When it is 20K, definitely we will convert this 5 important question to 10 important questions. Thank you so much. Bye-bye. Take care.